Welcome to the first lesson in triage. I'm Megan, and I'm just going to walk you through the ins and outs of triage and assigning an ESI to a patient during triage. Speaking of ESI, what is it? An ESI is an emergency severity index. It's a score that we give patients from 5 to 1, 5 being a non-emergent patient and 1 being the most emergent patient in the emergency room. We assign patients an ESI to help us prioritize our patient care to the best of our patient needs. So we would like to give the patient with the most emergent needs a lower score so that the doctors and the other nurses can see in the computer how quickly we need to be doing these interventions for said patient. Counts as an intervention. I mentioned intervention last when I was saying we assign an ESI due to patients' needs for intervention and the number of interventions. What counts as an intervention is any sort of procedure. So a lumbar puncture, if you can kind of anticipate that happening while they're here, that's an example of a procedure that would count as one intervention. Getting an IV is one intervention. An X-ray counts as an intervention. Any IV medications, those examples are pretty common things that we do in the emergency room. A laceration repair, putting on a cast, having an orthopedic doctor come and do their assessment on the patient in the ER. Those are all different types of interventions that count toward a lesser ESI. So we'll just go through and explain. So we're just going to stick with a similar situation and change it to kind of explain how differently it could be emergent, non-emergent. A patient comes in and they said that 2 weeks ago they fell off their bike. Their wrist still hurts, but the pain is pretty easily controlled. Mom's just kind of nervous because the pain hasn't gone away, would like to be seen by a doctor. Depending on the nurse, this could be an ESI of a 5 or a 4. A 5 being that no intervention is really needed. There's no swelling, bruising to the area. The mom said the pain was pretty controlled with Tylenol. They last gave Tylenol before they got here at 30 minutes ago. The girl says she's in no pain now, and they just want to be seen by a doctor. That would need no interventions in the emergency room, and that person is now the least emergent patient in the waiting room. That person can wait a long time if there are other more emergent patients that need to be seen first. Based on their ESI, based on the interventions that we think are necessary and how quickly we need them to be seen by a doctor, this person is described as non-emergent. The next one down is a 4. This person may need 1 intervention. So let's use the same. They fell off a bike. Now they fell off the bike yesterday. There is some bruising, some swelling from the injury, no obvious deformity. Their pulses are great. Cap refill looks beautiful. The patient is complaining of pain. They're having a hard time sort of getting ahead of the pain, but you don't think it looks too broken. It's not, there's no obvious fracture in their arm. There's no decrease in pulses or anything like that. They've still been went to school today, had a day. People would probably assign that a 4. The intervention, the 4 gets 1 intervention, like I said, and the intervention would be probably an X-ray. That being said, if there is a patient that you would assume has an obvious deformity, their arm is like this, unable to move their limb, their cap refill has changed, that sort of situation, you would make that person a 3 instead of a 4 because they are a more emergent patient. There are more interventions that would need to be done on a patient who has an obvious deformity than someone with limited bruising and swelling to the area. A 3 is the probably most common ESI assigned in the emergency room. It is saying that the patient needs more than 1 intervention, that a doctor needs to be seen, but it doesn't need to be seen right away. A patient that needs to be seen right away with 1 or more intervention would be assigned a 2. A 2 would be if a patient fell off their bike, it was a really big accident, and the bone is protruding through the skin. This is a 2 because it's a pretty emergent patient. It's a pretty good risk for infection, a risk for compartment syndrome. Based on their vital signs, based on their pain level, a 2 is a pretty common also ESI to be assigned since it is an emergency room. Most patients are there for an emergency. A 2 would be that a doctor needs to be in the room very quickly and the interventions need to be started soon. A 3, the interventions kind of be delayed, especially if you're you have a hallway of 4 patients and 3 of them are an ESI of 2 and 1 is the 3 can wait is the purpose of assigning them a 3 instead of a 2. The 2s need to be happening right now. You know, a good example of a person that's always a 2 is a patient who has sickle cell disease. They need their interventions to be started very quickly. They need an IV, they need all these blood work, they need oxygen, they need pain medication very quickly and to be seen by a doctor. You know, the example of a person falling off a bike, the person that has a bone protruding hopefully came by EMS, hopefully EMS put in a line, but that sometimes doesn't happen. So if they need an IV, they need it really quickly. They need to be seen by surgery really quickly and then possibly go to the OR within a very short amount of time to reduce the amount of injury, potential harm that the patient could have because of the injury. The last ESI we haven't talked about is the ESI of a 1. A 1 is hopefully not assigned too often because the patient is in life or death care. If a patient walks in the front door and the mom says the patient is blue and the patient looks to not be breathing, that person is a 1. If they come from EMS in the ambulance, the EMS personnel are doing CPR upon arrival or bag mask ventilating a patient, that is an ESI of a 1. That means that every single person needs to drop what they're doing and go into that patient's room and give every single intervention we can right now. The time is very important in these cases. It cannot be delayed. It needs to be started and done right now. Most of the time in the pediatric emergency room where I work, an ESI of a 1 states that patient is either not going to make it or needs to be intubated and put in the PICU pretty quickly. So that's ESIs and triage. We can kind of go through, since we don't have a computer or like any kind of database to do it, we can kind of go through. I wrote it down on a piece of paper, sort of what the first interaction in triage sort of looks like and how to go about thinking through an ESI. And then we'll practice one time with a fake patient I made up. And then after that, we'll disperse into 2 groups. One group of students will be the actual patients with these fake cards I made. You'll just read off the cards and explain them. The other group will be the nurses trying to assess and figure out which ESI to give is appropriate, or which ESI would be appropriate to give. So let's say a patient walks in and the mom walks up to the counter, and pediatric obviously, walks up to the counter and says that my daughter's name is Janie Doe. Her birthday is September 9th of 2009. And she hurt her arm. So the nurse would have the patient come sit down and start to go through a history, physical, for the patient. So they would ask if the patient has any allergies to food or medication. They would ask what medications the patient takes at home, what their medical history is, have they ever had a surgery, recent stays in the ER, if they've had their vaccinations, any kind of chief complaint, information that would help you gather how emergent this patient is while they are here. The next thing you would do is to sort of change your conversation to assessing the patient. Now, that being said, if a patient walks in and from across the room you can tell this patient is an emergency, you just skip all the questions and you take them back. You do not need to waste time while the patient's not breathing asking the mom if they're allergic to any medication. Breathing is way more important than an allergic reaction. We can save an allergic reaction as long as the patient is breathing. So let's continue. So let's say, Janie Doe is here. She hurt her arm. She fell off a bike yesterday, just like the earlier example I gave during the presentation. And she is writhing in pain, obviously uncomfortable. She has a pretty obvious deformity, has been holding her arm like this, unable to move her fingers too much, but her fingers have great cap refill, the color looks okay, her vital signs are pretty normal. The vital signs get taken by another nurse or a tech while you're kind of doing your conversation, while you're asking about what happened in their history, so that it can kind of all be clustered together. So based on this information, my assessment of the patient, her vital signs, what the mom has explained, I would assign this patient a 3. I would have them go wait in the waiting room until there's room for her in the ER, but that patient can wait a little longer than a patient who is assigned a 2. Yeah, so your turn to practice. Here's an example. Okay, Jasmine Doe comes up to the emergency room window and she states that her birthday is 4/23/03. You check her in. She says that she is allergic to milk and latex. and is here for belly pain. So Jasmine comes in, she's standing upright, but when she sits, she kind of holds her stomach, and you start to ask what's going on, and she says that I've had some right lower quadrant pain, just started an hour ago, and it hasn't seemed to go away, and my mom dropped me off at the front, and I came in, but my belly is really hurting, and you kind of see she's sweaty, it's pretty painful, got a fever, heart rate's elevated, you would palpate her belly, and if it's pretty painful, she has rebound tenderness or is really tender to the site, you could assign that person a 2. We would be ruling out appendicitis, which is pretty common in pediatric patients, and is considered an emergency just because if your appendix ruptures, you can get pretty sick. So that patient would be moved back before the patient with the arm fracture, just due to how quickly we should start doing interventions. They will need an IV antibiotics, blood work. They will need to be consulted with surgery and given some pretty significant pain medication to help their abdominal pain. Okay, so that's the example that we'll give here as just kind of a run through. I have a pile of patient cards for the patients and a pile of nursing cards, and we'll start to do sort of a simulation of a triage room based on the patients and nursing interactions. We'll go over the answers, and then we can switch so that everyone has the opportunity to critically think through what this patient could possibly need. That being said, this gets a lot easier in real life. It's easier as we practice. It's easier as you continue on, but it's good to start practicing and kind of understand how to assign an ESI and triage, why they're important. An ESI is easier to practice in real life. It's easier when you have a nurse who's done it for a long time helping you explain. You will go through some type of orientation to triage where you go with a nurse and you can see what she's thinking, how she thinks through the patient. So I hope that this kind of explains what an ESI is, how to use triage, why it's important, why assigning an ESI is an important tool to help with your prioritization in the emergency room. Let's practice.